Good question. I've never thought about that. I just use the concentrated vinegar. Baking soda, you can use a couple tablespoons in a quart of water, but the vinegar I just take straight out of the bottle.
Oh, do you? So these are two separate processes. You clean with vinegar and then clean with the baking soda solution, or do you combine them together?
Yeah, separate processes. Yeah,
Oh, I didn't realize that. So thank you for explaining that.
yeah.
Does it matter which one goes first from a cleaning perspective? I would imagine maybe the baking soda because then that might leave some residue, and then the vinegar would clean it up.
I generally do the vinegar first, and then follow it with baking soda.
And
Okay,
what's the reason for that sequence?
it's just a double precaution. That's all.
No, I mean, why do you do the vinegar first and not the baking soda first?
The vinegar will kill the mold and the bacteria, but you're going to leave residue on the surface, and so you scrub the surface to try to get rid of the residue.
Oh, that's the process. So the baking soda isn't directly killing it, it's more of a mechanical cleaner.
Right, right.
Okay, now I understand. Didn't get it. I thought that they were both killing the mold. Sorry about that.
Again, about validation, I've never validated that procedure, but that's what I recommend and what I do use, and it seems to work. Okay, but I haven't validated it with research data. Okay. I have to be honest with the population out there. I have not validated that particular step.
There, there we go. Now, with respect to some of the diseases that can be caused by exposure to mold, have you seen it causing any ulcer type symptoms like reflux or GERD?
I have seen people who have complained constantly of the upset stomach, GERD, reflux, and basically diarrhea, dysbiosis. Uh, and the cause I don't really know, but there is some information in the literature that suggests that both the mycotoxins and the bacteria can cause these problems. But again, it's another one of those things that if I go into the doctor with GERD today, guess what they do? They look for H. pylori, right?
Yeah. Or they don't even do that and they put you on an H2 blocker or a proton pump inhibitor.
Right, right. And then try to treat the symptoms, what they do, rather than find out what the cause is.
Oh, that's the common approach. Absolutely.
Okay, and yeah, I've seen these types of complaints in these people. Well, this young lady and her fiance or her husband, I don't know whether they've gotten married yet. Right here in Sacramento, that they have dysbiosis.
Hmm.
They got chronic diarrhea,
Interesting.
and and we've cultured the bacteria from the GI tract, and she had an overgrowth of Pseudomonas. And that's about all I can say on it now. Why Pseudomonas? Well, Pseudomonas is a very opportunistic organism and can become pathogenic, and therefore, and it's a very common organism that's found in water along with Proteus. So dysbiosis can occur in these individuals. I don't know what else to say, but diagnostics must be done to determine what organisms are overgrowing. Okay.
Now, with respect to maybe some common areas that people might be alerted to, I mean, obviously we can do the water checking and the visual inspection, but I would imagine the bathrooms would be a high area where people are going to find mold.
Yeah.
Has that been your experience too?
Yeah. Well, very typically, if you have a shower or a
Right.
bathtub, mildew growth around the ceilings. I think everybody has seen this problem in their bathroom.
Hmm.
That's all you have in the bathroom. Well, for example, right here in our home, I was noticing that we were having a little bit of mildew right around the ceiling, around the bathtub.
Hmm.
So I called in a plumber, and we cleaned all that out, and we put in a sealant that would not allow the growth of the mold. Okay, and the mold has not come back. So
Okay.
what we did was we dug out all the old sealant, treated it with vinegar, okay,
Hmm.
then let it dry, and then resealed it. Didn't take a shower in the interim or anything in that particular bathroom.
Hmm.
And let it dry out good, and then resealed it. And we've now been using it for approximately 5 months. And guess what? No mold
No
growth.
mold. And that's the caulk that would essentially be at the junction of the shower and the wall, or the
Yeah, right. Well, it's a
okay.
sealant. Actually, it's a tub shower. You follow?
Okay. So
Okay.
right where that interface is, you put that sealant on. But what about the the grout in between tiles. If people have mold growing on the tiles and they grout, do they have to take the tile grout out, or is there just clean it with vinegar?
Clean it with vinegar and keep it, occasionally you can use, if it's a small growth, if you got handy, you could use bleach if you want, but just keep it clean. That's all you could do. But I usually use vinegar. The other one I like to use is good old Comet. Comet is a very good scrubbing agency. Okay.
No.
Hey,
So, and I would imagine that making, one of your earlier recommendations is to make sure that the humidity level is somewhere between 40 and 60%. So, along those lines, you want to make sure, ideally, that if you're using your shower regularly, that you have a vent in there, and the vent works. It's actually expelling the humid air from the bathroom and out
that's right.
and outside, so you can keep that humidity low, because that's what's going to cause the mold to grow, right?
Yeah, that's a good recommendation. Whenever I take a shower, I do turn on the exhaust vent of the shower, because almost every bathroom has, an automatic fan that exhausts to the exterior.
Mm-hmm.
Turn it on. However, even with that precaution, you may still get some mold growth that goes on in the bathroom. Okay.
Okay. Well, that's great. I really appreciate all the information you've provided. And are there any other guiding principles or words of caution that you'd like to share with our listeners?
Well, the other thing is that if you're having chronic sinusitis, and you suspect that, and you also have water intrusion with, and there's bacteria and mold that are growing in the indoor environment, when you go to your doctor, invariably the doctor will say, well, we'll put you on antibiotics, right?
Mm-hmm. That's a typical response, sure.
Right. Okay, then what happens? They put them on antibiotics, but it doesn't clear up.
Another common response.
Okay, then the next thing the doctor will do is say, well, we'll try some prednisone or corticosteroids, right?
Mm-hmm. That's another, absolutely.
Well, you want to stay away from the corticosteroids. You want to stay away from the antibiotics. What you need to do is to do a culture, go to a good ENT physician, and actually get a diagnosis of what is going on inside of the sinuses. All right, you want to stay away from the corticosteroids, because 2 weeks use, or even less than this, of corticosteroids will increase your risk of other infections. Corticosteroids inhibit the oxidative burst produced by macrophages. Now let me describe what happens. Let's say you have mold that's growing in your sinuses. So the macrophages that in your body, called the innate immune system, are in there gobbling up the spores and of the mold, correct?
Mm-hmm. That's one of the
or
purposes.
the bacteria that are present. Then what happens is they put you on corticosteroids, and the role of the macrophage is to gobble them up, engulf them, and then produce oxidative bursts that kill the spores and the bacteria. Well, the corticosteroids do not inhibit the engulfing aspect of it, so they take up the spores and the bacteria, but the corticosteroids inhibit the actual oxidative burst produced by the macrophages. Now, the macrophages contain live spores and bacteria. Now, where do they go? Well, they can go any place else in the body they want to go to, right?
Sure.
So, therefore, you've increased your risk of other infections, particularly fungal infections. And I've seen individuals who have been put on corticosteroids because they've been exposed to these indoor environments, and then sometime down the road have been diagnosed with aspergillosis.